Welcome back to Care Beyond Code, the show from VBA, where we highlight the strategies and decisions in the healthcare admin world, making the process a little bit easier and better for everybody. And today we're learning from Jessica Gerow from Zelis. Jessica, thank you very much for joining the show.
Happy to be here, Adam. Thanks for having me.
I'm glad you're here, actually, because this show so far has told a lot of stories about individuals, patient stories, member journeys, and those are all good. We're building a catalog of those. We're grateful to be doing so. We've talked a little bit about tech, but we're really going to approach neither of those today because what we're going to do is help illuminate the broader ecosystem for our audience. Before I do that, because I've teed that up, we've got two stories for you today, by the way, viewers and listeners. Please help me understand where Zelis sits in the healthcare ecosystem so that we can set a foundation for where these stories live.
Yeah, I'd be happy to do so. And I'll just say, in the spirit of you expanding the ecosystem and the different lenses, I really bring a provider-centric lens to this story. So I am the SVP and general manager of our provider payments business. And Zelis tackles a couple difficult spots on the healthcare value chain behind the scenes, but the one I really focus in on is provider payments, so payer to provider. But as we'll get into, that has all kinds of knock-on effects to the patient and the member and the payer, of course. So inseparable kind of tangle of issues, but the specific piece that Zelis seeks to tackle and really why we exist is to modernize the financial healthcare experience, which is probably a really underserved but very painful and fragmented step of the journey for a lot of the stakeholders. Two more broad points about Zelis, and I promise they relate to the story and they help tee up the story. So, one, I think we are one of the only companies that are willing to take on this very messy, noisy, highly regulated piece of the value
Why?
chain.
Is it just because there's a bunch of red tape that is, you look up that mountain and you think, ugh, rather not deal with it, or why?
What I really think is because it's like 5 mountains. So to do this right requires not just expertise in healthcare, but cybersecurity, banking, technology, legislative affairs. Honestly, customer service is a huge piece of what we do. So it's not enough to know healthcare or to know payments. You have to be willing to take on that really difficult intersection and walk the balance of all the stakeholders that go into a transaction, and providers and payers are very sensitive about their transactions. So that's why I think it's been a tough space to take on. You can really, on one hand, count the others that are playing on this field with us just because it is so difficult. But I think with that difficulty comes obviously a lot of opportunity to improve the way it works.
Well, opportunity, if you can climb 5 mountains at once, that sounds better than having to use 5 different mountain climbers. Are we done with this analogy? I feel like we are, but let's put on some boots here. That was the last one. And go into a story that helps us illustrate the range.
So this is a story we're really proud of. Large, high volume health system. Our solutions work for all kinds of health systems, but I think they're really on great display with a large health system. This had over 10 TINs, over 500 providers, and 100 payers. The conversation started with the billing manager, and the billing manager said, we've got these 100 payers. I'd really like to have one solution to consistently and uniformly handle all the inbound payments, because right now it's a big manual lift. We have a growing backlog. Our volume of claims has grown 40%, but at that same time, our team has grown 0%. Just like every other health system in the nation, they're finding themselves being asked to do more with less or more with the same. So backlog of claims has grown 40%. Payer list has grown up to 100. And they're looking for one aggregated solution to bring it all together, allow them to post faster, and allow them to buy themselves back some time to focus on higher value activities.
How quick was that, though? How dense was that?
It had grown, that backlog of claims is what you're asking about, the 40%. It had grown by about that amount in just 2 years.
Geez, 40% in 2 years.
40% or not, the point still stands. It was volume outpacing the growth of technology they were working with, and it was just suffocating their systems and causing a lot of manual workarounds, because every payer has a different way they'd like to pay you, and that can be just very cumbersome to track.
Okay, so you have all of this web of like different processes and manual workarounds and people who are overworked, overstressed, and under-resourced. So you're able to come in across this 100+ payer system and do what exactly. And again, listeners, understand that this is not like a single member journey we're talking about. This isn't going to be a call to a hospital to get like a bill disputed. This is going to be something system-wide, technology-based. But help us out, Jessica. How do you step in to a mess like that and come out clean?
So yeah, if I've successfully established the pain points and kind of the backdrop that it was death by 1,000 cuts, then you're right, Adam. It was pretty big transformation needed, not just a quick silver bullet, Excel spreadsheet or something like this. So what we ended up doing after learning more about their needs and getting deep into their data was recommending our ZAPP Edge product. And just a moment on the product and service that is ZAPP Edge. That's what we call our very advanced, sophisticated ACH payments service. That it's a lot more than getting the payment from just point A to point B. We uniquely, in our provider facing portal, aggregate the payments from the tens or hundreds of pairs that you may have. We pair the data with the dollars intelligently so that you can post faster, and there's really never a question of what was this payment over here for versus this payment over here. It's digitized, it's at your fingertips, and it leads to just faster cash posting, less manual reconciliation, and fewer unresolved exceptions. So that's a lot about what ZAPP Edge does. How and why it worked for this practice is simple. It's because they did have a lot of payers paying them in different ways. They did have a lot of confusion about what ties out with what, since they were receiving it in different forms. And again, I can't stress enough, the data being paired with the dollars is so, so important to successful and accurate posting. So that happens frictionlessly in our portal. And then the last piece, which I didn't touch on yet, but which I know this system was excited about, is we have recently launched Claims Insights, which is it's free, but it's a value-added service on top of just the data and the dollars, because what's the natural next extension to data and dollars? Well, it's giving you actual insights and recommendations on top of that data. So you can avoid that unwanted denial next time, or you can complete that close out that remit even more successfully and more quickly. So data, dollars, and insights is really ZAPP Edge in a nutshell. And if I could add a fourth descriptor, it's the aggregation that this system really valued, because they just had so many different threads.
What I'm trying to piece together here, there are a lot of moving parts even in this description, is that of all of these various entities that have all of these different ways of administering care, or at least reconciling it on the back end, that created this like big, like messy hair clump of processes where everything's like sort of strung together and knotted. And like basically what it sounds like you've done is like come in and created this very effective system through which like each of these strands of hair could be like braided very well. So they're all tied together into one very nice looking thing and addressed either individually or group by group, so that the person that's been on side of the payer, it's been sitting and looking at this 40% increase in volume, can breathe. Is that effectively what we're talking about here?
No, it's second grade analogy of the day. And I'd say the core teams that feel this the most, this like alleviation of pain that you're describing, it's provider, finance, and rev cycle teams. Of course, they're the ones who get time back. They're the ones who see the dollars ringing up on the dashboard. But I don't want to understate, because I know this podcast is about the whole ecosystem. For payers, it means less avoidable back and forth inquiries, which can be fraught with a lot of tension. And then for the member or the patient, they're more likely to get their clean view of what they truly owe sooner, because the sooner the payer and provider can work it out, the sooner the patient responsibility piece can be sorted.
If I could just hear a little bit about like what happened on the other side of that. So they had this huge volume growth, either by acquisition or growth of geography or coverage or whatever. They are helped by you. You come in and install like a new way of thinking, a new way of processing. And what happened on the back end? Because this, the volume continues to increase. You have a better system to handle it, but like, what did that mean for people on the ground?
Yeah, so back to those provider finance and revenue cycle teams, where the rubber meets the road for them is A, are they actually posting more accurately and quicker? And B, are they getting time back, which goes with quicker? But are they getting time back to elevate to higher value activities in the practice? And so we need to show our ROI. We need to demonstrate that, because that's the other big piece of this we haven't talked about, is the change management. And tech is great, but our tech It does take some learning, and it's not a software that you just click on and off. It takes, an implementation, and it's not a hard implementation, but it takes the people on the ground that you mentioned buying in and wanting to use it and log into the portal. And so we stayed very close to their team during the implementation. We custom tailored some things just for their needs, because we know that a hospital system looks different than a small physicians group, looks different than an IDN. So we tried to be very, very thoughtful about their needs and what needed to work for them. Because if they didn't see a market improvement to their lives and their jobs, then we knew the ZAPP Edge product wasn't going to stick.
Of course. And it sounds like in this particular case, it did, and you were able to handle things efficiently, and that's good. But you bring up a good point, and this is probably a good time to break to the second story, but I'm going to use this breakwater to ask a question which I think most people who are either procuring technology or who live in the technology world, or by God have to use some of these systems, probably ask at the advent of meeting somebody like you or meeting somebody like VBA, by the way. I mean, people who listen to this probably already know who we are, but if they don't, they certainly understand the struggle of like, I've got this big mounting problem. In this case that we just said in this first story, it's volume of stuff going up really quickly, and I can't handle it all. Well, on top of that, sure, somebody comes in, I have this great system that will allow you to handle that. Great. One more thing, right? We experience this at VBA all the time. When we bring in new partners, like, okay, you have all these claims that need, work through, and VBA can help with that. Quick plug. But the point is that the trust is a whole other piece of this, because at the end of the day, like, this is like, we're still talking about patients and member journeys and things like that. And it's still like sensitive information, and like everything, at least on the individual level, seems high stakes. And now you're purporting to be able to climb all these mountains at the same time. You need to convince somebody else you could do it too. Could you give me your perspective on what that journey means, like in this industry, within this ecosystem? How do you build trust when it seems like there's more at stake than just, I don't know, some marketing technology software, which, could be plug and play and deal with ads all day as opposed to people?
It's a great question about the trust. It's something I spend a lot of my day thinking about. And also, how can we continually commit to elevating not just making good on the initial sales promise, which is to aggregate your dollars and data and save you time, but to keep elevating our own product and service with things like the Claims Insights edition. That was huge when we acquired Rivet in January. That was a huge vote of confidence for our provider experience and how very much we want to invest in it, because it's not enough to just move money from point A to point B. So that's one, is showing that we'll make good on this promise, but we also promise to continually hear your feedback and improve the provider experience over time. And then two, once you've climbed the mountain a few times with a few other providers, with their permission, using disguised case studies such as this to show the ROI and prove that, yes, slowing down to speed up is painful. And yes, you have to pay a little to save a lot. Kind of getting over that mental hurdle is more helpful when you know of peers, even if it's disguised, just examples of peers in the industry that have already taken that leap and been successful.
Well, then let's talk about one of the times you're able to make that happen.
How about the integrated delivery network story?
Let's do it.
I'll make sure it's different and additive to the large health system. I mean, ultimately, they're both large health systems, but some people from the outside would think everything within an IDN's four walls would be smooth. It's one family and it's cohesive, but families don't always work that way on the inside. And just like large hospital systems, they're likely the product of many acquisitions and roll-ups and stitching together over the years. So no, systems within an IDN don't necessarily talk to each other better. And even if they did, those providers in the IDN still may have 99 other payers not in the IDN they need to get paid by. So a lot of the same pain points applied in this second story. The integrated delivery network was moving about $500 million of its payments via paper. By that, I mean check annually. So
wow, that feels like a lot of risk just off the bat, but all right.
Well, thank you. It's not only cost, it is risk. Checks are so much more susceptible to fraud and interception than an ACH. So that's a part of it too. And then in addition to our kind of standard promise of digitizing the dollars, there was again this trust that we could do this without disrupting what was already functioning within the family, because it is an IDN and some of it was really smooth. So we did a lot of training and change management on this one, a lot of hands-on support to make sure that ZAPP Edge was again the right fit for them. And over time, we moved almost all of that 500 million from paper-based workflows into digital ZAPP Edge-based workflows, which they estimate, by their own estimate, saved them $400,000 a year. If anything, the 400,000, those are just the hard costs, but there's a lot of soft costs associated with not digitizing payments or not having payments all come through one funnel. And that's something ZAPP Edge really seeks to solve. So even if you've gone off paper and you've gone to the payer's free ACH solution, you still are dealing with your fair share of manual downloads and manual headaches and what I would call kind of the post-it note effect of a bunch of different passwords and usernames all taped around your desktop. With our aggregation, we solved that. So just to make the point, this system was heavily checks, but we can even digitize digital payments in a better way too, incidentally.
That's interesting. I have thought about it colloquially outside of this ecosystem just by having to like download PDFs of things and then think about them later as almost like digital paper. And that's a weird way to think about it, but like having to then manually like stitch them together, or like not manually, but like mentally, like even like look at them like, okay, this screen's got this, that screen's got that. Digitization within digitization is not something not a place I expected to go here, but it is interesting.
Me neither, honestly. But to put a bow on it, I mean, the more of your data and dollars you can have flowing through one portal, the more interesting things we can do on top with the claims insights I keep mentioning, denial prevention and detection. And that's where a lot of this is going next is once you've trusted us and enabled us to touch a portion of your wallet, we think we have a responsibility and an opportunity to help you manage more aspects of that wallet too, which I think a revenue cycle or treasury management team would be really excited to work with a company like Zelis on.
Help me look into the future a little bit here, because we've spoken about these stories, which are sort of two flavors of the same through line, which is that we brought on a system to modernize and in some cases systematize the way that that payments and other things are processed, making people's lives easier in the long run, making the healthcare experience better for everybody. That ties right in with our show. That's good. I don't want to ask for advice here, but I'm just curious about like, where do you think modernization goes from here? Like, what is it? Do you think there will be this advent of like this understanding of this digital paper that we've just said, where it won't just be modernization of like physical goods to electronic records, but then it's like tying together of electronic records to things? And you're doing this on the payment side, but I'm just curious where you think modernization will eventually go beyond that. What else is there? What are we not thinking about that we should be?
Another version of what you're asking is, when every check in the US is digitized, will there still be a role for Zelis? And I see so much value in what we can provide beyond just cleaning up paper. Electronic payments are no secret. We didn't invent them. The market has been plateaued out at about 80% digital for about 10 years. So digital is well known. But what everyone is starting to realize is that getting a payment digitally from point A to point B is totally table stakes and totally not enough, and that all the interesting questions actually lie in between point A and point B, like, when is my payment going to arrive? What was the claim associated with the payment? Why wasn't it the amount that I thought it would be? Or why was it even, denied? And if it was denied, what's my next best action or best chance of getting a different outcome next time? So you asked where this is going, and I think it's going towards Zelis being able to close even more of those gaps and answer even more of those questions with our data and our deep, deep knowledge of the provider workflows. So by connecting the payment to the corresponding data and then the insights, maybe a fourth add-on beyond insights is recommendations and actions to actually partner with you, get in your workflows, and improve your collections rate and your accuracy.
Do you think there is a time when we will actually like lose the paper aspect of it?
We like to say here that we move at the speed of healthcare, and also that we meet everyone where they are. So if a provider is more comfortable with checks, or for example, there will always be those out-of-network checks where the payer doesn't have the proper information to pay the provider digitally, that's fine. We can print and manage checks too, and we think there's room for that in the space. But what I would like to see is someone with some medical professionals in my family is, for them to be able to spend less time fighting with fax machines and chasing payments, and more time focusing on these insights and how do I improve my practice overall, and how do I give more time back to my people and more care to my patients. So That's maybe a lofty ambition, but I really work at Zelis because I believe there's a ton of opportunity there to be, to be cracked into.
Well, I think so too. I'm glad you're devoted to the cause. That's certainly what we are too, and for sharing these stories with us, and for helping us open up what this modernization really means at a system-wide level. Jessica, very much thank you for being on the show, showing us Care Beyond Code in this specific color.
Thank you so much for having me, Adam. Really enjoyed the conversation.
And for you viewers, listeners, everybody who sees us on LinkedIn, VBA is committed to this all day. Make that healthcare experience better for anybody. We do the same thing. We love Zelis. Zelis loves us. VBAsoftware.com. Go check that out if you'd like it. Otherwise, you can tune in next time. And whether it's tech, whether it's system-wide, or whether it's an individual member story, we're, again, devoted to institute a little bit more care beyond code.